today to launch the International Conference on Health Promotion themed Promoting Health During and Beyond COVID-19. I would like to thank Kenyatta University for hosting this event and also the very warm welcome and the wonderful entertainment. Thank you. I acknowledge the partners and conference participants for coming together for this event to share experiences of health promotion during and beyond the COVID-19 pandemic. The pandemic disrupted lives, livelihoods, communities, and economies. We also know that it put health workers under extreme pressure. The conference objectives urge us to create synergies, build partnerships, and identify future actions that may contribute to policies. This conference, therefore, gives us an opportunity to reflect on some of the invaluable lessons we have learned as a country and as the world from the COVID-19 pandemic. It will also contribute to identifying sustainable practices that will build on our collective efforts of improving the well-being of our communities, especially vulnerable populations who have been impacted most. Today, we see encouraging signs of declining cases of COVID-19 globally, but we cannot forget the fragilities of our health system and the need to increase our resilience so that we can protect ourselves from potential disruptions that are still a reality. Pandemics such as COVID-19 can impede our efforts towards building a secure health system that brings our country closer to achieving universal health coverage. Central to this effort is to ensure that our most vulnerable communities, especially women and children, are protected, because even before the pandemic, inequalities of access have existed. These inequalities have been a key concern that have heightened the government's investment towards increasing health access for its populations. This is why it is critical that we share our lessons and learnings from this pandemic and align our recovery measures with long-term sustainable strategies. Most notable has been the important contribution of health promotion in tackling the challenge of the COVID-19 threat and its societal impact. Many of the containment measures that we adopted and relied upon to prevent the public and healthcare workers from getting infected and our health systems from being overwhelmed imply a change in behavior. Hand washing, wearing face masks, and social distancing are all forms of this change. In addition, health authorities have tried to enhance protective behavior amongst the public by issuing warnings and recommendations about this new virus. The victory of these measures provides impetus to turn the tools of health promotion for any future health crisis. Whereas we've made remarkable successes in the control of the spread of COVID-19, we're yet to achieve our vaccination target. The efficacy of the COVID-19 has determined that the vaccines increase our protection from the virus. We are not safe unless we are all vaccinated. Going forward, we must ensure that our health promotion efforts are inclusive. We must ensure that they enable our populations to have access to affordable health care, as well as have all the information that will help them determine their health outcomes. Health literacy efforts and multi-sectoral action that contribute to increase healthy behaviors are key lessons that are essential in safeguarding the public's health. Our health and well-being is indeed the prevailing concern that takes precedence over all other issues. The multiple dynamics we face in ensuring that we build a resilient and stronger health system remains a national priority. Our collective diverse knowledge provides significant opportunities that we can leverage to develop meaningful solutions to global health crises. Through clear communication based on health literacy, as well as through collaboration across countries, disciplines, health, and education systems. It's for this reason that I once again express my delight that this Health Promotion Conference is underlining the importance of promoting health during and beyond COVID-19. You all here have opportunity to contribute towards a better understanding of the world we currently live in and development of best practices towards promoting the health agenda in the coming future. It's therefore now my honor to declare this conference officially open. Thank you very much for your attention, and I wish you fruitful deliberations. Asanteni sana.
Can we give another round of applause to Her Excellency the First Lady? Asante sana kwa mawaidha mazuri, and I request that we may take our seats.